consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathering and visual assessment to be videotaped and posted on YouTube for access by faculty at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and the information is not to be diagnosed. Therefore, Indiana Wesleyan University, the staff and faculty as well as the student are not considered liable.
Hi, my name's Angel. I'll be taking care of you today.
Hi, I'm Sammy.
What brings you in today?
Just a yearly checkup with my doctor.
Okay. So in a general assessment, what I'd be doing is I'm going to go ahead and look at a head-to-toe skin assessment for her. A general assessment for her is going to be that the patient's sitting up straight, she's alert oriented, she's dressed appropriately for the weather, her gait was steady when she was ambulating, speech is also very clear. I'm going to assess her skin. I'm going to look at the arms, the legs, the feet. Skin is dry and intact with no signs of lesions or lumps. Skin turgor is good. Skin's warm. Cap refill on the fingers is less than 3 seconds on both hands as well. Hair on her head is clean, dry, and intact. There's no lesions or lumps that I'm seeing. There's no dandruff. There's no lice. Eyes are noted, have no drainage, they're symmetrical. Normally I would have a pin light right here, but I'm going to go ahead and use the flashlight on my phone to check her pupils. Okay, so you're going to look at my shoulder. Okay. With that, her pupils start off as a 5 and then they go to a 3 on reaction. The reaction is brisk, it's not sluggish. Can you open your mouth for me? Looking at her mouth, there is no lesions, it's moist and pink, no sores that I see. Looking at the nose, it's symmetrical, there's no drainage noted. Looking at the neck, it's midline, don't see any visible nodes, no lesions noted. I'm going to palpate your neck, so let me know if you feel any tenderness.
Okay.
The patient doesn't have any tenderness or soreness upon palpation. No marked lymph nodes noted. Are you having any chest pain or trouble breathing today? Okay. Then I would take my stethoscope. I'm going to auscultate her chest. I'm going to listen to her lungs. You would listen to this to listen for any clear vesicular sounds or any abnormal sounds such as wheezing, crackles, bronchi. The places that I would start to listen to would be here and here. Then I would go to the patient's side over here and here. I would have them take a deep breath while I'm doing this. That's the interior. On the posterior part of the patient, I'm going to go ahead and start from here, go over to here, and then down, and it's kind of like in a snake formation. Down, 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 and then you go to the outer parts of the lobes down here. Then I'm going to listen to the heart. I'm going to listen for an S1 and S2, any clicks, murmurs, pericardial rubs. I'm going to start listening right here, and then I'm going to go down and around to the patient's heart all the way over to here to listen for those things. Okay, now I'm going to ask the patient to lie down. Okay, so normally I'm going to start with an inspection of her stomach. There's no lesions noted. I can't see an active heartbeat in the aorta up here. No hernias noted. Umbilicus is midline. No lesions noted there either. Normal coloration for ethnicity. Then I'm going to listen in all 4 quadrants of the stomach for up to 5 minutes for any vowel sounds, whether they be hypo, hyper, or just normal vowel sounds. The quadrants I usually will start from here to here, up to the top, and then back over to the left side of the patient. Then you're going to percuss using your non-dominant hand on bottom with your dominant hand on top in all 4 quadrants of the stomach. Dullness should be heard over the liver and the spleen, with tympany heard over the stomach and intestines. Then I'm going to palpate the abdomen and ask the patient if they're having any tenderness. You do a light palpitation. Any tenderness?
No.
Okay. Are you having any trouble on urination?
Nope.
Okay. Having any abdominal pain normally? Okay. Okay, then I'm going to have the patient sit up. I'm going to check muscular reflexes. Okay, so hold my fingers.
Yeah.
Okay, squeeze as hard as you can. Push me towards you. Pull me towards you, push me away. I'm going to check the top first for radial pulses. And I'm going to go down to the bottom. Push your feet up towards your chin. Now push them down. And then I'm going to check for pulses down in the feet. Pulses are noted. Cap refill on the toes is less than 3 seconds. Usually if there's any specific problem with the patient, I would go into a more in-depth exam for that particular area, but since this is just a general exam for a head-to-toe assessment, I'm just going to do a general one.